Heartworm Diagnosed is a parasitic worm that can infect your pet through a mosquito bite. An infected mosquito injects a larval stage of the worm under your pet's skin. These larvae mature in pet's organs for approximately 7 months, traveling through the body to heart and blood vessels of the lungs. These adult worms breed to produce microfilaria, baby heartworms in the bloodstream, which are then drawn up by a mosquito when it feeds on the pets, continuing the cycle again. Mosquitoes are hard to keep out of both the yard and house, so even your indoor-only pets are at risk. Where are heartworms found? All dogs and cats are susceptible to heartworm infection. Geographically, heartworms are a potential threat in many countries around the world. All dogs, regardless of age, sex, or living environments, are susceptible to heartworm infection. Indoor as well as outdoor cats are also at risk for the disease. Can people get heartworms from their pets? No, it can only be passed on by mosquitoes. If one of your pets has heartworms, can they give it to your other pets? No, again, the only way heartworms are transmitted is through the bites of an infected mosquito. What are the signs of heartworm disease in dogs? Signs of heartworm disease may include a mild persistent cough, reluctance to exercise, fatigue after moderate activity, decreased appetite, and weight loss. Dogs may develop heart failure and the appearance of a swollen belly due to excessive fluid in the abdomen. Dogs with large numbers of heartworms can develop a sudden blockages of blood flow within the heart. This is called cable syndrome and is marked by a sudden onset of labored breathing, pale gums, and dark bloody or coffee-colored urine. What are the signs of heartworm disease in cats? Symptoms may include coughing, asthma-like attacks, periodic vomiting, lack of appetite, or weight loss. How is a pet tested for heartworms? The test requires just a small blood sample from your pet, and it works by detecting the presence of heartworm proteins. If your pet tests positive, further tests may be ordered. When should my pet be tested? Annual testing is necessary, even when pets are on heartworm prevention year-round. Heartworm preventives are highly effective, but not 100% effective. If you don't get your pet test, you won't know your pet needs treatments. Heartworm preventives do not kill adult heartworms. How is heartworm diagnosed in cats? Heartworm infection in cats is harder to detect than in dogs. The cat is an atypical host for heartworms. Most worms in cats do not survive to the adult stage. Cats with adult heartworms typically have just 1 to 3 worms. It's important to understand even immature worms cause real damage to the lungs. The preferred method for screening cats include the use of both antigen and antibody tests. Your veterinarian may also use X-rays or ultrasound to look for heartworm infection. Is heartworm disease curable? If your pet is in a good condition, it is 100% curable. But depending on your pet's age and if they have some other conditions going on, they may not be a good candidate for the treatment. What is the recommended treatment for dogs? From the moment your dog is diagnosed with heartworm disease, your dog must not be allowed to exercise up to 2 months after the last treatment. Your dog will be started on a once monthly medication called a preventive, such as ivermectin, to kill immature heartworms and prevent new infections from developing. You should continue to give it to your pet for the rest of his life. Your dog will also be given the antibiotic doxycycline or minocycline for 30 days. This medication kills bacteria which live in the heartworms called Wolbachia. These bacteria help the worms survive and reproduce. And then there is a 30-day rest period in which you don't use doxycycline anymore. On day 60 or 2 months after starting heartworm preventive, you will need to bring your dog to the clinic for the first injection of melarsomin, the drug that kills adult heartworms. Because complications can occur, your vet may prescribe prednisolone for your dog to reduce side effects. On day 90 or 1 month after the first injection, 2 additional injections of melarsomin must be given 24 hours apart. What is the heartworm treatment in cats? Because there is no safe or approved adulticide for cats, many are managed conservatively with restricted activity and steroid therapy such as prednisolone. The steroids reduce the severity of vomiting and respiratory signs. Administration of doxycycline and ivermectin to an infected cat could be beneficial. Surgical removal of worms can be attempted in cats in which worms are detected by echocardiography. What is the prevention for heartworm? Heartworm preventives come in different forms, including monthly chewable pills and topical sputum medications, as well as injectable medications that is given every 6 or 12 months. Heartworm preventives are available only by prescription from veterinarians.